if a woman is successful with having orgasms and it's just not what it used to be or what she knows it could be, and we get this a lot postpartum. From our perspective, we talk about maybe the tissues are not healthy hormonally. So we might ask her to talk to her doctor about estrogen levels, that kind of path.
Great.
We can talk to her about having moisturized tissue versus lubricated tissue. So her vaginal space should have a level of moisture, just like our mouth always has a level of moisture. But when I eat, I salivate. Like I really have extra fluid in my mouth to break down that food. When we're aroused, we should have extra fluid. So we check on those markers. And then we can also talk about bulking up the pelvic floor. Maybe she went through a time of atrophy from a muscular perspective. So having patients with a strengthening program that's appropriate for her can really take her orgasms to the next level or just where she knows they could or should be. Do you have anything from a sex therapist perspective?
So I just want to go back to talk about your permission of allowing women to explore their bodies. Right? Because if you don't know what type of touch, right? And I mean, again, we were talking about, maybe one lip is, bigger or more sensitive than the other, right? If we're talking about the inner labia versus the outer labia, right? And even our clitoris might be more sensitive on one side versus the other side, right? So if we're not giving ourselves the opportunity to really explore what that is, then how can we really kind of optimize or tap into that full range of pleasure? And then the other part of it, and that I love that you talk about, is this atrophy, right? And I tell my clients, if you don't use it, you lose it, right?
Oh, absolutely.
So if it's been months, years since you have been engaging in any type of penetration, right? Or exploring your body in terms of arousal and orgasm, right? Then those tissues, those muscles are just not going to be able to sustain, right? And then I think that last part that you were talking about in terms of that lubrication, this is also, I think, where there's some misconceptions, right? Where it's like, oh, I get wet on my own, it's all good, right? However, right, the lubrication comes from the vagina, right? The vagina is self-lubricating. The clitoris is not. Right. So I recommend for my couples to always use lube, regardless of how much vaginal lubrication is happening, because we want to be able to create as much like slickness and smoothness on the clitoris, right? So that it's not, we don't experience that kind of friction. It has so many nerve endings that it's going to be hypersensitive to any type of like, oh, and then that creates the tension.
Right? So true.
So lubrication is so important. I love just coconut oil, right? Organic coconut oil, fractionated coconut oil. That way it's not, you're not chunking.
Absolutely.
But if you're using condoms, obviously, condoms do not sustain oil-based lubes, right? So then you want to find a really wonderful water-based lube that can be helpful as well. And so lubrication is so important. Actually, I think back to the numbers, right? I think it's about 80% of women report a higher rate of orgasm with the use of lubrication.
Wow. That's a big percentage.
That's a big percentage.
We've actually switched from asking our patients, do you use lubrication, to which lubrication do you use?
Perfect.
To just normalize it. And we always recommend have it on hand. Put a little bit, even if you think you don't need it. And just see what happens.
A little bit. And it's not, so a little bit, you want to just kind of graze over the clitoris, right? And also the inner and outer labia. Right. It's not just where the penetration is happening.
Absolutely. Because the whole organ is experiencing.
The whole vulva needs that kind of love as well.